What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for November 13, 2020. Why women are dropping out of the workforce during COVID-19 and what the long-term impacts. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Stefania Albanesi, an economist who studies women in the workforce. They discuss how a disproportionate number of women in the United States appear to be dropping out of the workforce during the pandemic, presumably to care for their children and to oversee virtual learning. They talk about what this could mean for their careers. Let's listen.
Stefania Albanesi, thanks so much for joining me.
Thank you for having me.
So today we're going to talk about the impact of the pandemic-related recession is having on women. Talk to me about what we're seeing in terms of women in the workplace.
Well, I would identify two separate phases. So the first phase was in March and April and early May when we had all the government mandated shutdowns, and even in the states that did not have that, just a lot of concern about catching coronavirus from establishments, with a lot of contact with workers from the standpoint of employees or with other customers and workers from the standpoint of customers. So what we saw was a big reduction in activity that resulted in employment losses in basically high contact occupation, mainly in the health sector, in personal services and in sales occupation that requires direct contact with the customers. And also, most of these occupations cannot be done remotely, so they are also inflexible from that perspective. And they happen to be occupations that are mainly female. So, for example, healthcare is 77% female as an occupation. So women were disproportionately affected by those activities, which is kind of remarkable because in most standard recessions, it's usually male-dominated manufacturing occupations that tend to lose jobs first and the most. So the impact of the COVID shock initially was very, very gendered in that respect. And then as these lockdowns and in general, as we got out of this first phase of very intense, reaction to the coronavirus, we saw a resurgence, that we saw in the aggregate data and employment numbers, varying quite a bit by state, depending on, the pandemic effect on the state. And there is where you see more of a subtle reaction in that women, particularly higher income and married women, have not returned to the workforce, and their employment numbers have not picked up as much as they have for men or even never married women. And so what we've seen in the summer, and also there were some worrying numbers out of the Bureau of Labor Statistics in September. There was a big decline in participation, particularly of women with children and married women more in general. And this, I think, is not so much related to, the effect of the pandemic directly on employment, but more the indirect effect of having to manage possibly children who are at home with unpredictable, schooling arrangements and so on. And this is also mainly more of a higher income phenomenon. So whereas the job losses that we saw in March and April and early May were pretty much across the board, for women because they were so exposed, from a occupation and sector representation. The summer and early fall numbers that we've seen of, reduced labor force participation seem to be more concentrated amongst higher income women.
So these women are dropping out of the workforce. What is that going to mean for the long term?
Well, so that's what it would seem. And it's a little bit hard to compare to the past. So traditionally, though this has not been something that has happened as often in the last 20, 25 years, but traditionally women did drop out for 2 or 3 years when they had their first child or, during childbearing, and then they would, go back. And that usually is quite costly from the standpoint of earnings, not only the earnings that women lose in the time where they're not working, but their, prospective lifetime earnings when they return. So many women cannot find a job that was comparable to the one that they had before dropping out, for childcare reasons. And so they re-enter the job ladder at a lower wage. And this has a permanent effect on the earnings for the remaining time of their life. Now, in this case, there's at some level, on the one hand, it may be better than usual. And on the other hand, it may be worse. It may be better because we all understand that this is a common shock that is really out of the control of any single individual. And so having a gap in your resume or having had to leave the workforce for a year or a year and a half, may not be seen with any, stigma or, any concern about, a particular woman's commitment to their career and so on when things go back to normal. So in that respect, I think, the effect should be smaller. On the other hand, there is a caveat to that, the impression is that we don't have, a lot of, pervasive and solid data on this, but it would seem that many firms are innovating very fast and transforming workplaces and adopting new technologies that were perhaps already available, but because we are all sort of dealing with this shock, it's forcing firms to change and innovate faster. So usually something that does happen when workers take some time out of the workforce is that they experience what economists call human capital depreciation. So your skills, some of your skills may become obsolete, as well as you become rusty in some of the skills that you still have. And that may be happening at a faster rate right now, particularly in sectors that are responding to this crisis with a lot of workplace innovation. So these are, on the one hand, it might be better than usual. On the other hand, it may be worse than usual. And it's hard to know at this point how the two effects will, meter out. And it may be that there's a variation across specific occupation or specific firms with respect to these two forces playing a role.
Mm-hmm. Are we seeing race as a factor here?
Yeah, so yes, because particularly in personal services.
And when you say personal services, what do you mean by that?
You think about, hair salons, nail salons, but also health aides, people who take care of children or elderly, folks in the context of their homes and so on. There's a lot of immigrant labor, particularly Latino immigrants, but also, Asian immigrants, as well as, African-American women are overrepresented in these sectors as well. And so there's definitely a dimension of that. Particularly for African American women who tend to be overrepresented amongst the never married women in the low end of the wage distribution, that certainly has had an adverse effect on their employment, more so than I think for white women who tend to be overrepresented a little bit on the higher end of the wage distribution. So there has been a racial dimension. And if you do look at the employment situation report, the monthly report from the Bureau of Labor Statistics, actually for immigrant women, there is a table that focuses particularly on the various labor market outcomes for immigrant women and men. They have seen the largest decline in employment to population ratio of all racial groups. So that's something that is potentially very worrying.
Mm-hmm. And some of it, I imagine, has to do with society, right? Women definitely do most of the unpaid labor in the household, and they still, even though women have in recent years really caught up with men in terms of being in the workforce, women are still doing the unpaid labor at home.
Yes.
So is this so society is contributing to this?
Well, so that's I've actually done some work on this, some years ago with one of my co-authors, where we were trying to sort of examine this question. Where does this process start? Because to the extent that women have less financially rewarding career paths ahead, call it the glass ceiling. Whatever it is, then within a household, say take a couple of parents, it's individually optimal for that household, for the mother, the female partner, to be tending more to home activities, such as you take your kids to the dentist, or you help them with Zoom school, or whatever it is. But then the question is, why is it that women have less rewarding careers? And so what we looked at is that historically, indeed, because being pregnant had so many health consequences, including high probability of dying, and also children needed to be breastfed, and there were no alternatives to that. So there was actually an economic reason that led women to have to devote more time to childcare, and therefore, while you're doing that, you do also other home activities. And then we looked at the fact that that's no longer really the case if you look at the data on the direct impact of pregnancy and childbirth on labor productivity of women, because we've had, even though the US is one of the worst countries with respect to maternal mortality and morbidity in the world, but certainly relative to the 30s and 40s and 50s, we've made a huge amount of progress. So the question is, why are we still here? And so what we think is it's sort of a self-fulfilling kind of circle. So there is the societal expectation that women may be more attached to performing activities related to their children, or less attached to having a career, and therefore they then have fewer career opportunities, which makes it optimal for them to behave like they're expected. And even the most egalitarian couple, for the most part, if they decide to be egalitarian in their division of childcare and home care responsibility, they're actually missing out economically, because the society is set up based on that expectation. So there are countries like Sweden that essentially mandate paternity leave by saying, okay, as a couple of parents, you have access to what I forget the exact number of days, but a certain number of days for maternal and paternity leave. And if the father doesn't take at least a fraction, then as a couple, you lose a bunch of those days. So it's sort of forcing couples to be more egalitarian. And that's not so much to, make decisions on behalf of the parents, but sort of change, a little bit the societal expectations about who amongst the parents should be taking care of particularly very, very young children. Mm-hmm. And of course, in the US, it's hard to think that something like that would ever be acceptable. But what's behind it is the notion that you have this self-fulfilling, arrangement that is really hard to break, with individual decisions. You need some kind of a shock to the system. Mm-hmm. But what you're pointing out is why are we seeing, over the summer, this data suggesting that married women, particularly higher income married women, seem to be dropping out of the workforce. That is most likely because, they are the lower earner of, the two parents. That would be the optimal thing to do. And what you do see is that as you go up the skill ladder, gender wage gaps actually become bigger. So what is not known, there's been a lot of work on the fact that on average, gender wage gaps have gone down in the United States. But most of that is because there are now more skilled women, so women with a college or college and more degree in the workforce. And in fact, on average, women in the workforce have higher years of education than men in the workforce. So American women who work are more educated than American men who work right now. And this has been the case since the early 90s. But if you condition on the level of education, on the level of experience in a particular occupation, the more you condition, the more the gender wage gap grows. So, particularly the high-end occupations, you see more gender differences in earnings and wages. And so that's, I think, one of the reasons why we see this behavior sort of at the high end of the income distribution.
Mm-hmm. And these are difficult economic times, and they're probably going to stay that way for the near future. What do you see happening in the next 6 to 12 months?
Well, so a lot of that will depend on how we deal with the pandemic itself, right? Because some of the phenomena that as economists we've been sort of discussing as potential scenarios, such as, some types of jobs get permanently eliminated because they get automated away, or, we find a remote way to perform the task and so on. So what we call structural change, so changes in technology that are persistent or permanent, are more likely to happen if the health shock lasts longer. Mm-hmm. So when we thought that this was going to be a 6-month phenomenon, nobody, was expecting that there would be permanent changes to the way we work or the way we live in response to that. If this goes on for a couple of years, the effect is going to be a lot deeper, and there will be significant structural change. So it's really hard to then forecast if we're in the middle of, a structural break in the way the economy works. But there's definitely been, we've seen some evidence that, manufacturing companies have increased the degree to which they are moving to automated production, because of course robots don't catch viruses. And the technology was already there, but it's very costly to adopt new technology. So you either do it if you have a great new opportunity, or if you have a big negative shock that forces you to do that. And, some personal services are really hard to substitute with, technology or automation. So that probably won't happen. But, there's still a rethinking, of expectation with respect to those services, which may have persistent effects.
Stefania Albanese, thank you so much for joining me. I really appreciate it.
No problem. Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.